All right. They see you guys?
I guess.
Yeah.
All right, you can turn the camera.
Oops.
Yeah, that's good.
Okay.
All right, my name is Deborah Negron. I'm here to talk about death with dignity or dying with dignity. It's assisted suicide, so it's about people that are terminally ill with either cancer or something that's going to ultimately cause them to pass. They use it for to basically take their lives and to go peacefully instead of in a horrible way of dying. So I'm here to talk about that and to hopefully persuade you into not seeing it as so much of a negative thing and seeing it maybe more positive than most people would. So first thing I want to talk about is this little needle here. Lots of people think that when someone does assisted suicide that they're going to take their life with a needle, like somewhat like maybe they would at a vet with a dog. Maybe injecting something into their leg or their thigh that's super painful, that's going to cause them to die in a horrible way, and that's not how they do it. What happens is a doctor will prescribe the patient a small prescription bottle that'll either have 1 to 3 pills in it, and the patient will take those pills whenever she or he is ready to pass on in a peaceful way if they're terminally ill. So it's pretty simple. It's not painful, very peaceful. There was someone by the name of Brittany Maynard that impacted the world. She showed up on CNN. She did an interview with CNN, and my phone's vibrating. She did an interview with CNN, and basically the whole world saw her. There was millions of people that watched her video within a day or two, and she became very popular, and everyone started following her, and that's how most people know about assisted suicide now, is because of her. She was diagnosed with glioblastoma, which is a very aggressive form of brain cancer, and she started to experience the effects of the cancer taking over her life. She started experiencing tumors and memory loss and very painful headaches and all these adverse effects to basically dying in a horrible way, the way that the doctors explained to her how she would go. So she decided that she would get the prescription from a doctor, and she did. And it took about 3 months for her to actually take the medication, because she had hopes. She had hopes that maybe the cancer would go away and it wouldn't come back, or maybe the chemotherapy that she was doing was going to help, but unfortunately it didn't. So when she noticed how bad it was getting, one morning she woke up and she realized that she couldn't remember who her husband was, and that was her breaking point. So from that point forward, that day forward, she decided that she was going to take the medication and take her own life. I personally don't see it as so much as suicide as most people would. A lot of religions say that suicide is not acceptable in the Bible. But when you're in the situation and you're dealing with the pain, and you're waking up every morning and you're not remembering who you are, or who your husband is, or maybe who your kids are, and they're having to watch you go through all of this pain and suffering, then, that might alter your opinion on assisted suicide. So every person's case is different. Some people think, well, because I'm religious, I'm just going to go ahead and deal with the pain. But again, when you're in this situation and you're dealing with it, you might feel differently. Let's see. So yeah, there's different medications and chemotherapy that you can do during the process of cancer that can delay the dying process, if you will. But it's really only lengthening your life, and when you're terminally ill, nothing's going to fix it. Nothing's going to make it go away. It might give you a little extra time, but that's as good as it's going to get. I already talked about Brittany Maynard. She was a huge impact. Assisted suicide is only available in 6 states out of the 50 states in the whole United States. The rest, a lot of other states are trying to pass the law to allow it, but they haven't done so yet. But Florida is not one of the states. Brittany Maynard did her assisted suicide in Oregon, I believe. And so hopefully, eventually, at some point, we'll have the option in more states around the United States so that people have the option here at home or wherever they live instead of having to pick up and move their stuff to a different state to do it. So that's that. I had a few other things on slides that I wanted to possibly go over. This one basically says that it talks about assisted suicide, and it talks about the medications that they use. They use something called secobarbital, which is the that's going to be the capsule, and then there's a pentobarbital, which is the actual drip IV that you can also use. Most patients just use the pills itself rather than the IV drip. That's kind of going away for the most part, just because it's easier for you to swallow a pill rather than having to have an IV put in your arm and a drip. So the medication basically just causes you to fall asleep and you just never wake up. So it's very peaceful. It's just like falling asleep at night, except it kind of forces you to fall asleep. A lot of people do it within their own home. You don't have to do it in a hospital or at a hospice center. Brittany Maynard specifically, she did it at home in her own bed with her husband by her side, her mom, a few good friends. So it's a lot better way of passing rather than passing in a horrible way and maybe having to be admitted into a hospice center. This story in particular grabs my attention with Brittany because of my father. When I was 11 years old, I lost my father to the exact same thing that Brittany Maynard passed from, which is the glioblastoma, which is an aggressive form of brain cancer. And this is a picture of him. I don't know if you can see that too well. This is him, and this is me here. And that's when I was about 11 years old. So that's my reason for believing and being so strong about the assisted suicide, is because of him and because I had to watch him pass the way that he did. No one should have to pass away that way. That's it. You have any questions?
Nope.
No?
Really good.
Other than my phone.